Prior to performing the procedure, introduce yourself and verify the client's identity using the agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can participate. Discuss how the results will be used in planning further care or treatment. Perform hand hygiene and observe other appropriate infection prevention procedures. Provide client privacy. In women, drape the anterior thorax when it is not examined. Inquire if the client has any history of the following: family history of illness, including cancer, allergies, tuberculosis, lifestyle habits such as smoking and occupational hazard, medication being taken, and lastly, current problems such as swelling, cough, wheezing, and pain. Inspect the shape and symmetry of the thorax from the posterior and lateral views. Compare the anterior posterior diameter to the transverse diameter. Inspect the spinal alignment for deformities. Palpate the posterior thorax. Assess the temperature and integrity of the chest skin. For clients who have respiratory complaints, palpate all the thorax areas for bulges, tenderness, or abnormal movements. Avoid deep palpation for painful areas, especially if a fractured rib is suspected. In such a case, deep palpation could lead to displacement of the bone fragment against the lungs. Palpate the posterior thorax for respiratory excursion or thoracic expansion. Place the palms of both of your hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Ask the client to take a deep breath while you observe the movement of your hands and any lag in the movement. So palpate the thorax for vocal or tactile fremitus, or the faintly perceptible vibration felt to the chest wall when the client speaks. Place the palmar surfaces of your fingertips or the ulnar aspect of your hand or closed fist on the posterior thorax starting near the apex of the lungs. Ask the client to repeat the words such as blue moon or 1, 2, 3. Repeat the two steps moving your hands sequentially to the base of the lungs. Compare the fremitus on both lungs and between the apex and the base of each lung. Using either one hand and moving it from one side of the client to the corresponding area on the other side, or using two hands that are placed simultaneously on the corresponding areas of each side of the thorax. Percuss the thorax. Ask the client to bend the head and fold the arms forward across the chest. Percuss in the intercostal spaces at about 5 cm or 2 inches interval in a systematic sequence. Compare one side of the lungs with the other and percuss the lateral thorax every few inches starting at the axilla and working down to the atrium. Auscultate the thorax using the flat disc diaphragm of the stethoscope. Use the systematic zigzag procedure used in percussion. Ask the client to take a slow, deep breath through the mouth and listen at each point to the breath sounds during a complete inspiration and expiration. Compare findings at each point to the corresponding point on the opposite side of the thorax. Inspect breathing patterns. Inspect the costal angle and the angle at which the ribs enter the spine. Palpate the anterior thorax. See posterior thorax palpation. Palpate the anterior thorax for respiratory excursion. Place the palms of both of your hands on the lower thorax with your fingers laterally along the lower rib cage and your thumbs along the costal margin. Ask the client to take a deep breath while you observe the movement of your arms. Palpate the tactile firmitus in the same manner for the posterior thorax and using the sequence shown in the picture. If the breasts are large and cannot be retracted adequately for palpation, this part of the examination is usually omitted. Percuss the anterior thorax systematically. Begin above the clavicles in the supraclavicular space and proceed downward to the diaphragm. Compare the lung on the side to the lung on the other side. Displace female breast to facilitate percussion of the lungs. Auscultate the anterior thorax. Use the sequence used in the percussion, beginning over the bronchi between the sternum and the clavicles.